as we are now moving forward in defeating COVID-19, we must stay ever vigilant. It's been a surreal past 14, 15 months, tumultuous. In that time, this week marks the tragic murder of George Floyd and the social unrest and social change, justice that continues to occur. So at this point in time, unless needed, I will discontinue our Monday morning press briefings. Additional information will be coming out pertaining to city and hospital medical type auspices, and also with the Governor Baker and Lieutenant Governor Polito's May 29th edict that we are 100% open, and again on the mask wearing. And please, for individuals who feel much more comfortable in wearing the masks, that is fine, and they should not be ostracized. Also, June 15th, all emergency powers will go away pertaining from Governor Baker, Lieutenant Governor Polito, and myself and Commissioner Helen Colton Harris. So we are going to be moving forward. We will give you appropriate updates when needed. Hopefully we will come together in more of a celebration. But as of today, we will end the Monday morning press conferences moving forward on defeating this COVID-19. With that, I want to thank all the members of the media, TV, radio, and print for getting out the pertinent information to our residents and business community. I want to thank Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, who's been such a great partner before COVID-19 and working in concert with the city and Commissioner Helen Colton Harris, as with Dr. Robert Roos, the Chief Medical Officer for Mercy Hospital Trinity Healthcare. They were faithfully here every Monday, and we were only a phone call away many a times as we started to gear up to defeat this COVID-19. I'd also like to give a lot of thanks to my cabinet heads and rank and file and their families who have been tested and true and have been there through natural and man-made disasters as we now approach next week the 10-year marking anniversary of the tragic EF3 tornado that hit our city of Springfield June 1st, 2011. I'd also like to thank our sign language professionals. Thank you for always being here to make sure everybody and anyone was getting this pertinent information. And I want to thank the Focus Springfield, who has been invaluable making sure that we've been able to be open, transparent, and get public access information out to our residents and business community. And I want to thank you, each and every one of you, the residents of the city of Springfield and our business community, for your patience, understanding, collaboration, and cooperation as we are now moving forward to defeat this COVID-19. We still need that. I know it's been frustrating, but we still need that same type of cooperation to starve this COVID-19. So that's the first announcement pertaining to the pressers. Secondly, I'd like to take a moment of silence. We recently lost 2 DPW staff members or workers. Mary Kate O'Connor from Indian Orchard, longtime Indian Orchard resident, She was a hot ticket. She really kept the gentleman at DPW in line. She fought a courageous battle. She came back to work, and unfortunately, she lost that battle, and now she's up in heaven without any pain. And Billy DeLude, DPW worker driver, who fought another valiant battle, came back to work, wanted to come back to work as Mary Kate, and just recently retired, and he lost his battle. So to Mary Kate O'Connor and to Billy DeLude, rest in peace, my friends. Moment of silence, please. Thank you very much. We'll go to the stat sheet. Since this ordeal has started, COVID-19 total confirmed cases, 22,388. Monthly total is 663. Weekly total continues to lower, 156. I want to commend Commissioner Helen Carlton-Harris for her leadership, our Vax Force, which just met last week, and a really prestigious honor of being highlighted in Ebony magazine, a preeminent, well-respected African-American national magazine, for what Vax Force, Commissioner Helen Carlton-Harris and I and the members have done to reach out to disadvantaged communities, which are many a times the brown and black community. They did a very nice article and photo shots highlighting the city of Springfield on this leadership initiative. So to Helen and the Vax Force, congratulations and thank you very much. Speaking of that, Helen and I will continue to target 18 to 35-year-olds. This is not only with the PSAs and social influencers, but as the Doobie Brothers would sing, taking it to the streets with vaccinations, going to events and even businesses. We'll also be partnering with Dr. Kerouac and Bay State Health Systems, I believe out in the Orchard area, and also in other subsequent areas in the city and with businesses. The 18 to 35-year-olds, I know you think that you are invincible, and I hope you are, but why take the risk or why take the gamble? No excuses now. The vaccinations are there. It is good for you, good for your family, and good for our community. No appointments necessary. Whether you're at the mass vaccination site, Governor Baker's mass vaccination site at Curative and the Eastfield Mall, or many of our neighborhood locations here in the city of Springfield, or affiliates of Bay State Health and Mercy Hospital. So please, that is important so we can continue to starve and defeat this COVID-19. And again, Bay State Health, I think, is looking at the Orchard and Pine Point. We appreciate that. We continue to be in the yellow. We can't be laxed again. We want to move toward the green. So the big key words here are shots in the arms, shots in the arms, shots in the arms. Get vaccinated. We're going to continue to push that. Again, as of May 29th, no masks are required. But if you feel comfortable, you should wear them. And you should not be ostracized for that if you have any underlying health condition. So please, public, be respectful of that as we move to get everybody vaccinated. Helen and I are going to continue again to push and expand our neighborhood vaccine sites. No appointments are necessary. Governor Baker, again, the homebound vaccination program continues. All that information is on our website. We still continue to have telephone banks for Health and Human Services, elder affairs, and libraries to help out individuals be able to get their vaccination sites shots if needed. We still continue to deliver to homebound seniors meals that they need. The Oasis Food Bank John Foley and Sedesco and the Food Bank of Western Massachusetts will continue on Fridays at the old Sears Automotive Building at the Eastfield Mall. We've been servicing about 3,500 families. As I mentioned before, AMR has been another great corporate citizen and partner. Patrick Leonardo, Director of Operations. To stop the spread, will continue. Testing will still continue at the Eastfield Mall. My cabinet heads, and especially Director of Facilities and Parks Management, Patrick Sullivan, and Commissioner Helen Colton Harris. We continue now full court press transition plans to begin reopening all our city buildings, so stay tuned on that, and that we'll make an announcement on that, on how that will occur. Some might be in a phase type aspect, but shortly reopening them right around the corner. Just some quick updates before I go to the cabinet heads, brief updates. Again, to Friendly's founder S. Presley Blake, their memorial tonight. I'm honored to be able to speak at that, honoring this entrepreneur who created thousands and thousands of jobs and old school business acumen, and his bond was his handshake, which in these days would be much appreciated too. Chamber of Commerce Forum, we had the Mayor's Forum, and that went very, very well. I'd like to thank Nancy Creed and Mayor Don Humison, myself, Mayor Reichow, and Mayor Nicole LaChapelle, East Hampton. We had some good information. We had some good laughs last week. The National League of Cities Mayors Forum, and I want to thank my Chief Diversity and Inclusion Officer, Attorney Talia G., and other staff members. I was a panelist on that with other mayors across the nation, whether from San Francisco or others, London Breed, and Mayor Woodward from Tacoma, Washington. We really hit it off. We had a few laughs there, but putting across how we've handled best practices on how these cities, whether large or small or mid-size, have handled the COVID-19 crisis, and how we're dealing with job creation and social equity anchor institutions. So I was pleased to be on that national forum. We had something that was near and dear to my heart. My mom, Clara, God rest her soul, being a seamstress, and matter of fact, her 88th birthday would be next Tuesday, June 1st. Azalea Sewing Academy Handmade Shop. Lucy Sanchez, she opened it up at Boston Road, 1728, it's right next to the Chuck E. Cheese, and fantastic. About 18 machines or units up there, teaching classes and doing that sewing and alterations. And I just thought it was a very heartwarming story. Entrepreneurship, you know, opening up your own business is tough at any time, especially COVID-19. But it was a wonderful ribbon cutting. And congratulations, Ms. Sanchez Lucy. I wish you the best of luck and continued success. The Azalea is her young granddaughter's name, so very heartfelt. I continue meeting with pastors from across the city. Last week was Pastor Eric Brown and City Councilor Marlo Brown, and my Coach LeVar Glick out of my office, and Chief of Staff Tom Ash, as we continue to move on youth development aspects and taking some stuff to the streets and neighborhood events. Wahlburgers grand opening is tomorrow. Had the opportunity to get a sneak preview with Chef Paul Wahlburger Friday evening. I'll tell you what, he is so genuine, humble, appreciative, just a regular down-to-earth guy who is very excited to be here in the city of Springfield, and we're appreciative of his belief in investments. The food was great. Price points are very good. I believe it's going to be a very big hit here in the city of Springfield for young and old. So that officially opens up tomorrow with the ribbon cutting. So welcome to Wahlburgers. Many years of success. Through Commissioner Helen Colton Harris and Elder Affairs Director Sandy Federico, we continue to engage our seniors. We'll have another car parade, parade at the Ray Jordan Senior Center this week. Indian Orchard Citizens Council, the Bloom campaign, the hanging baskets, which has been wonderful. I want to commend Paul Karen, who's helped them out, and Zeta Govan, president of the Indian Orchard Citizens Council. We all donate to that, and many of the businesses donate. Beautiful hanging plants, Boston Road Business Corridor, Parker Street, Pasco Road. We'll be making that announcement this week. And they're very well kept, and it just sends a nice welcoming message to the residents, business community of Springfield, and to the visitors of Springfield. So congratulations and thank you on that. Of course, we're never going to forget, and we're always going to remember our veterans and their families, especially those who've given the ultimate sacrifice. We will have our annual Memorial Day events Friday at noontime here at City Hall, Court Square, Veterans Walk, and we will put the appropriate wreaths. I want to thank Director Tom Belton, Veterans Director Tom Belton, Deputy Director Joey DeCaro. We will also go to St. Michael's Cemetery to put a wreath there by the Veterans Monument there. I want to thank Sheriff Nick Kochi, who again reached out to me last week early in the morning. He will have teams of his people, staff, that will be flagging our veteran cemeteries. Again, we are looking for volunteers, and that information is on the website. You can contact Deputy Director Joey DeCaro to make sure that we properly honor all our veterans' cemetery sites. More good news. MGM, the Friday music concerts will start June 4th through September 3rd, and a lot of great acts we'll have, and some really great local acts. Fat, featuring Peter Newland, Trailer Trash is well known, Derek, and the Fun Bags. Michelle Brooks Thompson, she's outstanding. She played at my inauguration too, and she's an award-winning artist and singer. That's just to name a few. So that'll be outdoor, and that'll start the Friday music concert starting June 4th at 7:30 p.m. through September 3rd. As you know, which was recently announced last week, Star Spangled Springfield, the 4th of July fireworks are coming back to the riverfront. I want to thank Judy Matt and the Board of Directors of Spirit of Springfield, all our generous benefactors, especially Mass Mutual, and who's always been there for us. I want to thank all my cabinet heads, especially Helen Colton Harris, that we're able to pull this off. And I think it's great. We did it right after the tornado had hit, 2 or 3 weeks right after. It's a great morale boost, not only for the city of Springfield, but for Western Massachusetts. So that's moving forward. On the quick update pertaining to cabinet heads, Police Commissioner Cheryl Clapper, who was here earlier in our cabinet heads meeting, she has to cover another meeting. Deputy Bill Cochran is here. There's nobody down with COVID-19, which is excellent. Dirt bike and fireworks patrols continue with partnership with the state police units and our Eye in the Sky. We continue with our DOJ meetings. Last week, again, EMS awards, AMR awards, Symphony Hall went very, very well. If you haven't had a chance to watch it, the body-worn camera footage was able to be released on our officers who saved that 2-month-old with CPR. Just unbelievable what they did. Officers Josue Cruz, Luis Delgado, Francisco Luna. Just absolutely tremendous if you get a chance to watch that video. We continue to take guns off the street. Last year we took off 275 guns. Already we've taken off 82 guns off the streets to date. More guns seized this weekend. We are seeing a rash of overdoses. Springfield Police and Fire, especially Springfield Police, has given out Narcan left and right, been able to save many lives, one that we couldn't. And I think Commissioner Helen Colton Harris also speak of mental health calls are up a lot. We have a separate unit with Behavior Health Network that goes out with our officers to deal with those mental health calls. Commissioner Calley is at a state fire chiefs meeting in Worcester this morning. Deputy Chief Mike Cass will be here to give an update. They are down 2 in COVID. Hopefully we'll have those individuals back shortly. We had a tragic fire on Northampton Avenue. They were able to save 2 lives, but 1 individual perished. And thoughts and prayers and sympathies go out to the family members that have been affected. Speaking of that, we have held again on deaths overall since this ordeal has started. No new reported deaths, and hopefully it stays that way, we'll see. So total deaths since this COVID-19 has started is 246. Of that, 99 are white, which encompasses 40.2%. Black is 55, which encompasses 22.3%. Hispanic is 85, which encompasses 34.5%. Asian is 7, which encompasses 2.8%. Long-term care facilities, which has really stayed stagnant for months, has stayed at 60. Residential passings are 186, again, for a total of 246 since this has occurred. On the DPW front, again, Chris, we're sorry for the losses of 2 of your workers, staff members. Nobody's down with COVID-19, which is good. Pothole patrol, again, call 311. Director Signoli has those crews out there. Street sweepers continue. Yard waste continues to get picked up on your recycling dates. We still are in need CDL drivers, traffic light technicians. We have roadway construction going on in a lot of places. Saturday, I was down Central Street Quarter. That is coming along very, very well. And Worthington Street, as we continue to work on our restaurant row area there, that kick-out portion should be done by the end of the week to continue to assist on outdoor dining. The Fort Street has already been done, and the Fort is going very strong on that. Superintendent Dan Warwick indicates to me we have now served 7,559,452 meals, breakfast, lunch, and dinner to our students and families since this COVID-19 started. Just this past weekend, 75,936 have been served. We will continue 4 to 6 p.m. in the evening, the sites that we have, while kids are back in school now, and we're going to continue our feeding during the summer months also. The COVID rate in the schools is minuscule, and Danny will speak of that. Very, very low, whether students, teachers, minuscule on that, all the precautions we're taking. Summer school, we will have summer school. We will have live and remote summer school to catch up and continue to move forward in our learning. With this COVID-19, we found that we're going to move forward on the virtual school. That'll be coming this fall. We're going to honor all our retirees. School committee meeting, we have one tonight, executive session, but honoring our retirees this Thursday evening. Thank you for your dedicated service to our school system. Vaccines, Superintendent Warwick, Jeannie Clancy, and working with Commissioner Helen Colton-Harris, we are setting up to vaccinate 12 to 16-year-olds in our school system. Well, thank you on that. And the MCAS, the grades that had to take them, that has been facilitated, whether it's live in person or virtually. Finances. My CFO, TJ Plan, indicates to me since this ordeal has started, deficit is $9.6 million. The FY21 deficit is $4.8 million. Deficit in grants, we have spent, and again, told all cabinet heads, spend every dime you have to provide for our residents. Business community, $40.7 million has been spent. Of that, $31.4 million we've been able to pawn off on grants, leaving us with $9.3 our current deficit. As you know, the FY22 budget was rolled out, $755 million, nearly $750 million has been rolled out. It is now to the City Council for them to do their due diligence and review, and I'm hopeful that they will accept and pass the budget. Again, that moves forward a number of initiatives, no layoffs, all services move forward, and quite a testament to our fiscal discipline and stability that we have here. I believe this week or Friday, State Representative Carlos Gonzalez and the delegation on that point is going to look to honor my finance team for what we've been able to do the last dozen years. Facilities and Parks, Pat Sullivan, COVID-19, nobody down. Very good. He continues to work hand in hand with Commissioner Helen Colton-Harris on vaccination neighborhood sites. They continue to work together with all cabinet heads on our reopening of city buildings, so stay tuned on that. We'll be making announcements on it. Summer recreation is going to go forward. Positions still need to be filled. Summer rec positions and lifeguards. It's all on the website. I see my HR labor director, Attorney Bill Mahoney, shaking his head. So summer rec positions and lifeguard positions still need to be filled. So please, if you can do it, apply. All the hoops are up. All the basketball hoops are up. The only exception of Adams Park, because when that group tried to put them up, they broke the backboards, so we're waiting for new backboards to come in, so shortly they'll be up. This week, Park still had after-school programs. I'll be with Channing. Cal Casolo does a great job at Bowles School, honoring those kids that went through that program. We had a great announcement with Keep Springfield Clean and Healthy. I want to thank Pat Sullivan, and again, this is Be a Hero, Curb Appeal, Springfield Clean, the neighborhood councils, the concerned citizens of Springfield, Mary Ann Mahoney, who really moved this forward, and the school department, Superintendent Dan Warwick, which we're going to put forth educational curriculum, why it's important to do your part and not litter, pick up litter. And I want to thank Dorman School, who the posters are up. The kids did it, 3rd and 4th graders, and Putnam Vocational, Alyssa, who did a great job on the other poster. She's going to be moving on to art school. Echo Dev, Chief Development Officer Tim Shee indicates nobody down with COVID, which is very, very good. Going back to parks and facilities, summer programs, we are starting to take sign-ups. Camp Star Angelina and also Camp Wilder, Pottinger School, and Renaissance. We're going to be running summer programs. That announcement will be coming out shortly on that. So again, Chief Development Officer Tim Sheehan, he'll be speaking to you about retraining and the jobs lost. We've been able to continue to work with Wayfinders as our conduit, my conduit, to help out homeowners and renters for utilities, mortgages, rents. We're also now putting a component together to help out landlords, 20 or less units that they can apply for direct assistance. This is important to make sure we stabilize our tax base and keep families, all good families, each and every one of them, in their homes. That makes for a stronger neighborhood, street, and city, and we'll continue to work with HUD on larger units, but that's very important. Timmy will also speak to our anchor institution partnership, which Bay State Health Systems is a partner in also, as far as diversification and hiring and procurement. On HR, labor, and law, Solicitor Ed Pakula update. Our DOJ meetings continue, another one this week. State unemployment rate is down to 6.5%. And with that, I will now turn it over to Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, for his update. And after he's done, he'll take questions. Thank you very much.
Good morning, Mr. Mayor. Good morning, everybody, and thank you, Mr. Mayor. Really wanted to mark this 15-month mark by acknowledging your leadership. I think as I talk to many people across the country, CEOs like me have often gotten caught up in the political side of this pandemic as to masks or treatments or restrictions, et cetera, but you really have consistently partnered with medical science, and you've been a consistent voice, and I think we've had much less of that noise related to the politicization of this pandemic, and it's really a testament to your leadership. So I salute you for that, and thank you very much for these opportunities. The COVID-19 pandemic is still raging across the world. There are still 167 million cases, 3.45 million deaths. A recent analysis by The Economist magazine, just looking at excess deaths levels, puts that number closer to 10 million who have died from the pandemic over the course of the last 15 months. So that because of shortfalls in testing in poorer countries, the 3.45 is a real underestimate. The news from the United States, though, is really very, very good. There are greatly declining new case rates in all 50 states. That's still at a reasonably high level, 24,000 new cases every day. Still 500 people dying every day of COVID. Still 24,000 people in the hospital. Here locally in Western Massachusetts, we're seeing significant declines as well. Bay State's numbers were 29 COVID patients across the system. That's the first time we've been below 30 since October. 8 of those are in the intensive care unit, and most of them, 25 of the 29, are in the Springfield campus. Mercy reports 2 patients. Both Mercy and Bay State are seeing test rates below 2%. Hamden County is seeing a decline in new case rates too. It's about a third of what it was 2 months ago, which is a good thing. The county still, though, is tied for second highest in the state in that others are going down faster, and that is, as the mayor noted, a story of vaccinations. Across the United States, 50% of the population and 60% of adults over 18 have gotten at least 1 dose of vaccine. 40% of the population and 50% of adults over 18 have been fully vaccinated. That's the country as a whole. Massachusetts is one of the top states in the country for most vaccine measures. We're very close to our target of 4.1 million adults having gotten at least 1 shot. 3.4 million of the Commonwealth have been fully vaccinated. The rate has fallen off a little bit, about 50,000 shots a day, down from their peak of 80 to 90, but that's still a reasonably good clip. As the mayor noted, Hamden County is sadly the last in the state for vaccines, though. 46% of the population has gotten 1 dose, and the rest of the counties are somewhere in the 50 to 70% range. 34% of those in the county have gotten fully vaccinated, and it's 45 to 60% in the other counties. And so it's not great to be in the last position, but I think the thing that worries me a bit more is that the numbers really haven't changed much in the last 2 weeks. Since I was here last, they've only gone up 2 or 3%, which means we're getting to the hard part of getting to persuade people that they need to get the shot. In terms of looking at who are the hesitant individuals and why are they hesitating, there actually has been some marketing research that corroborated some of the reflections I shared with you a couple weeks ago. And if you look at the state of Massachusetts, about 8% of the folks who are hesitant are in a kind of wait-and-see mode. I want somebody who I know, a friend, a family member, someone I trust, to get the shot. About 7% are really skeptical about COVID, the disease. They don't think it's such a big deal. Maybe they're young. Maybe they think it's some kind of a hoax. And 3% are people who just can't spare the time. They cite cost issues, but obviously since the vaccine is free, the cost is wages they would lose if they took time off from work, etc. So I think there really therefore are a couple of things that we need to do. One is to try to get to people who are influential with the folks who are skeptical. And so I'm hopeful that some of the people watching are willing to talk about their experience with the vaccine and convince friends or family who are still sitting on the sidelines. Whether or not that's an issue about COVID or the shot, my hope is that you can be persuasive in ways that some of us have not been so far. The other thing that we've been trying to do is to make it amazingly convenient to get the vaccine. And just about all the sites now are open for walk-in appointments, in addition to being able to schedule an appointment online or via the 211 site or vaxfinder.mass.gov. There are now over 900 sites where you can get a vaccine in Massachusetts, and my hope is that it'll be coming soon to a parking lot near you. So in terms of Bay State health strategies, right now we're continuing to put out information about the seriousness of COVID for all age groups, information about the effectiveness and the safety of the vaccine. It has slowly chipped away at resistance, but it has been a slog, but we need to keep at it. We are going to make it even easier to get shots. Our sites are open for walk-ins. Our Holyoke site from Tuesday to Saturday, 8 a.m. to 6 p.m. And we're going to be working with Commissioner Carlton Harris to have walk-in sites in Springfield communities in addition to our 3 health centers. We're going to focus on that really getting the shot not only protects you, but protects those you care about, particularly people who might be older or vulnerable because of comorbid conditions. So my hope is that people will try to be persuaders and ambassadors for vaccine, and I thank you for that. As you probably all have read, there are plans to move forward with lifting all capacity restrictions in various venues, restaurants, bars, arenas, etc. on May the 29th, so it should be a great Memorial Day weekend. The mask order will be lifted as well, or modified to be in line with the CDC guidelines. That is to say that people who are vaccinated don't need to wear masks, even indoors or in crowded situations. People who are unvaccinated ought to wear masks and continue to physically distance. Now, this has created some concerns by some who are worried that it's an honor system and people are going to try to cheat on it. But the bottom line is that people ought to be not worried about wearing a mask if you've been vaccinated. I think the CDC was right about the science on this, but they really did not think through the practical rulemaking side of it. Nevertheless, I'll be happy to be walking around without a mask after the 29th. I hope that most of you have gotten your shots and are going to be able to do the same and persuade some of the remaining individuals to step forward and protect themselves too. So with that, I will stop, and thank you again, Mr. Mayor, for all of these opportunities. I'm going to sort of miss, on the nicer days, I've been walking over from Chestnut Street, and I'll miss my little walks through my native Springfield, but I'll have to find some other way to get my steps in from now on.
Give a round of applause, Dr. Kerouac.
Well, for me, well, I think we ought to have a round of applause for you, Mr. Mayor, as well. Thank you very much.
And my cabinet heads are rank and file, okay?
Yeah.
And then with the rest of the 22 students, any questions or comments, Dr. Kerouac?
Dr. Kerouac, I don't know if you saw there was a report over the weekend that Boston Globe about the difficulties in Hampton County in particular. If you saw that, do you have any particular response to some of the concerns? They are obviously well in Hampton County, they're different in Springfield as opposed to like Interland, the resistance.
Yep.
Seattle, Palmer, and West and Westfield versus resistance in Springfield and the neighboring communities. I don't know if you had any response.
Yeah, well, does kind of sting a bit to be portrayed as kind of the country bumpkin, if you will, of the state. And so I wish we weren't the last in the state, and we're doing everything we can to change our status there. I would say every patient or every individual who was featured in that story did seem to me to fit into one of those categories. Either I'm going to wait and see, which is kind of an odd stance to me personally, given that 163 million people have gotten the shot. Or I think, COVID is no big deal, or, the system has never been good to people that look like me. So there are a number of sort of skeptical things where people are not ever going to really take information from people who portray themselves as experts and have found stuff on the internet to support their own theories. My hope is that people close to them can begin to persuade them as we continue our campaign.
Specifically in regards to reaching out to people of color, I know that there's been some evidence to suggest that we speak out that problem within your own staff, and certainly that continues to be an issue here. What is the Bay State doing to try to continue to reach out to that, specifically that group of people, to make sure that they are vaccinated? Because that was a particularly prominent part of that story as well.
Yeah, well, we've been blessed to have Dr. Derain Walker, who's an African-American infectious disease expert who's gone quite public with his vaccine story. both on social media, campaigns, billboards, held at town halls, et cetera, and have continued to work on culturally appropriate messaging for communities of color through Commissioner Carlton Harris's Vax Force, which I think got some well-deserved recognition from Ebony Magazine as really trying to hit the proper notes in terms of the outreach message. So I think it's tailoring the right message, getting the shots to where it is like the easiest thing you can do. You just need to walk across the street or whatever to get the shots. We've done this in our own organization by bringing shots to various team meetings and stuff like that. So it's just continued influence and continued persuasion and encouraging people to speak up when they finally have taken the plunge and protected themselves.
Any other questions from any other media members?
And it's a kind of technical question. As we move more and more towards these like walking clinics and not scheduling people, because Moderna and Pfizer have these very specific, cold chain management, which makes it a little bit more difficult. How is that working in terms of like, not having to be engaged? There's been a lot of story about like CVS is kind of vaccine because they don't have one of those there in the store.
Well, in fact, Pfizer has found that a lot of the ultra cold is not needed. And they've applied for an emergency use authorization that once a vaccine, the vial has been thawed, that it can be kept in the fridge for 5 days. That's enabled us to deploy vaccine to many of our private doctor offices or our primary care doctor offices. And so I think that they were extra cautious when they first put that out, and I guess a lot of people bought some pretty expensive freezers for no good reason, but we now know that the vaccine will do just fine under normal conditions after it's thawed for a period of several days.
And just one last question, in terms of getting back to normal, so to speak, with all these changes, now being looked by the state, outside of the healthcare settings themselves, the actual delivery of care, where is the base state in terms of, are they allowing employees to come back if they want to at this point? There are some employers who are like, I'm still not letting employees back in here. And I know there's still a lot of questions about what the long-term implications that are. I don't think anybody really has an answer as to what they're going to do longer term right now. But where is it in terms of your back of house employees? What they can do and where they can go?
Well, let's leave aside the 8,000 employees who have to come to work to be face-to-face with a patient, right? 88% of them are vaccinated right now, and we're continuing to work to get those numbers up to be close to 100%, as we've done with flu vaccine, for example. For the 4,000 or so who are supporting Bay State, through IT or finance or one of those other roles, many of them are saying that, gee, we love being at home, we're just as productive as we used to be, we don't ever want to come back. That's a minority. Then there's a minority that says, we can't wait to get out of the house and come back and see all our friends because it's driving me crazy to sit here. And then there are a wide middle group that says, we'd like to come back a day or two a week and basically see people then and then have the option of working from home from time to time. As I understand it, that's consistent with what a lot of other non-healthcare employers are seeing as well, and we're working our way through that. It is going to be a new world of work. It's not clear to me that we're going to need the square footage of real estate that we do right now if people are going to work from home 2 or 3 days a week. And I think that because of the competition for talent, we are going to need to be more flexible. And people will also be pursuing the possibility of either we will be seeking talent elsewhere in other states in the union, but people who work in Western Mass will now have the option of being employed elsewhere in the country too. So I think it's going to transform the world of work in ways that are profound.
Are your spaces open though for those employees if they want to come in right now, or is that not that?
Yeah, many employees are coming in a day or two a week as it stands, and it's kind of an optional thing, but the buildings are 20% occupied.
There's no rule that you can't. Some employers still
I think so. No, anyone who needs to come in or wants to come in can come in, but they need to practice social distancing and wear masks when they do.
Any other questions or comments?
Yes, thank you very much. Appreciate it. Thank you, Doc.
Okay. Without further ado, the elegant and eloquent Commissioner of Health and Human Services, Helen Halton-Harris.
Thank you, Mayor. This is our last scheduled Monday, but I want to be clear, the data will still go up on the website of the City of Springfield every Monday. So the charts that you see here, you will still be able to access on Monday. The cases by day: Sunday was 51, Monday 20, Tuesday 23, Wednesday 13, Thursday 25, Friday 12, and Saturday 10. The cases by age: 0 to 10, 28, 11 to 20, 25, 21 through 30, 26, 31 to 40, 27. 41 through 50 was 20. 51 to 60, 13. 61 to 70, 7. 71 to 80, 5. 81 to 95. 91 to 100, 0. The cases by age group, we continue to see the majority of our cases under the age of 50. So under the age of 30 was 51%. 31 to 50, 30%, and 51 and over, 19%. Your zip codes: 01 had 2 cases, 1%. 03, 0 cases, 0%. 04, 17, 11%. 05, 14, 9%. 07, 17, 11%. 08, 14, 9%. 09, 35, 22%. 18, 9, 6%. 19, 23, 15%. 28, 1%. 29, 10, 6%. 51, 14, 9%. Cases in the last 6 weeks: April 11th, 548, April 18th, 504, April 25th, 425, May 2nd, 265, May 9th, 154, and this week, May 16th, was 156. So in the City of Springfield, we pretty much maintained our case level over the last week. Black African American was 21%, other 24%, white 26%, unknown 28%. The line graph: 663 cases this month. We had a very successful clinic for second dose individuals Saturday at St. John's Congregational Church. We vaccinated over 210 individuals during that clinic. Thank you so much to all of you who came. I really want to thank the pastors who showed up, who were just amazing. Pastor Dalvin and Pastor Morgan, Reverend Morgan. Thank you so much for what you did. Thank you for bringing your volunteers. Thank you for supporting the vaccination clinic for the City of Springfield. We are beginning to work with Springfield Public Schools to think through how we vaccinate our individuals, our young folks, 12 to 16. We are working with Curative on that initiative, and we look forward to rolling that program out potentially next week, but we will give information as it becomes available to our students and families. We still have our clinics at Pine Point. Pine Point and Indian Orchard will be 2 new sites that, as the mayor indicated, we will work with Bay State on. Greenleaf, J.C. Williams, Ray Jordan, Greek Cultural Center. We are still vaccinating and we are still here. Everyone across the nation is experiencing a slowdown in vaccinations, and so smaller clinics may be the future for us. We were used to doing the large clinics with over 200 individuals, but we will still have clinics available, and vaccinations are going to continue to be available along with testing. Our numbers we're looking good in many areas, but as has been noted, we are still behind the rest of the Commonwealth. The number of individuals who have been partially vaccinated in Springfield, 17,806. The percentage fully vaccinated, 43,825. While the Commonwealth is reporting a 47.2 figure for fully vaccinated, Springfield's number is 28%. And you can tell by that we are 20% less vaccinated than the rest of the Commonwealth. I ask you one more time to please understand how important it is for you to get vaccinated. If you're vaccinated, that means the options open up in terms of just your life and what you can do as a fully vaccinated individual. I know there's hesitancy, I know there's resistance, I know there's fear, I know there's concern, but what I do know is that if you get vaccinated, the sooner you get vaccinated, the sooner our lives can fully get back to normal. Thank you, Mayor.
Thank you, Commissioner Colton Harris, for that update. We'll now go to the public safety update. And again, pinch hitting for Commissioner Bernard B.J. Calvi, who's he's at a state chiefs meeting in Worcester. His Deputy Chief, Michael Hess. Chief Hess.
Thanks, Mayor. Good morning. Like the Mayor already mentioned, we're doing pretty well. We have 2 positive COVID cases in the department, but they should be coming back this week. We also unfortunately had a fatal structure fire early Sunday morning on Northampton Avenue. It was an accidental kitchen fire. One occupant was rescued from the 2nd floor. CPR was initiated by firefighters assisted by Springfield Police and AMR, but unfortunately that occupant passed away a couple hours later at Bay State. And that's all I have this week.
Thank you, Deputy Chief Hess. We'll now get the police perspective. Again, Deputy Chief Bill Cochran. Commissioner Clapper was here earlier. She's covering another meeting. Deputy Chief Bill Cochran.
Thank you, Mayor. Good morning, everyone. Well, I'm pleased to announce that we have 0 COVID cases now at the Springfield Police Department. In other areas, the Mayor might have mentioned earlier, we did have an uptick in overdoses over the weekend. We had 5 overdoses. Unfortunately, one of those people did not recover. We administered 3 doses of Narcan. We are having the Click It and Ticket campaign over the next few weeks. We encourage everybody to use their seatbelts when they're driving, and just for safety's sake, if they get into an accident, it certainly could save their lives. And Friday evening around 8:30 p.m., the Springfield Narcotics Unit and members of the Massachusetts State Police Gang Task Force arrested a 23-year-old male named Kenneth Watson on firearms charges after a long investigation. Detectives located Mr. Watson over on Summit Street carrying a bag loaded with firearms. He was placed under arrest, and this happens to be the 82nd illegal possession of firearms arrest that's been made in Springfield so far this year.
That's it, Mr. Mayor.
Thank you.
Thank you, Deputy Chief Cochran. We'll now get an update pertaining to our schools with Superintendent Derain Walker.
Thank you, Mayor. Good morning, everyone. We're still running our meals program, and since schools closed down in March 12th of 20, we've provided 7,559,452 meals to families. This weekend, on Friday, we provided 75,936 meals. We're now running the program 4 to 6 on Monday, Wednesday, and Fridays. And so we're feeding kids in school as well as providing it for families that are staying remote. We're going to continue, as we have in the past, to provide an aggressive summer feeding program, going to places where there's summer programs and feeding sites to continue that program. So it's been very important for the city. Our COVID positive cases have been really minuscule, as the mayor said. Schools are open and going well. From 5/13 to 5/19, we had 12 students and 2 staff. So again, very, very low rates. Our graduation program, we're going to go outside following the health commissioner's recommendation at Central High School from June 7th to 17th on our normal schedule for the graduations. They'll be at 6 p.m. in the evening. We built in rain dates because we're going to be outside this year, so we'll work on any of those. We have left the Fridays open of those 2 weeks and early the following week. Since we've gone back to school, we've been dealing with the MCAS, so we've been providing students both remote and live. We've been getting that MCAS requirement, that testing program done, and our teachers and principals have done a fabulous job accommodating all the situations that need to be taken care of with that. We're planning a very aggressive remote and live summer school program. So we're going to be running that. It'll start just after July 4th and run on the normal schedule. But we're going to have a live program at every school. But for students who don't feel comfortable coming in live, we're going to provide a remote program also. Next year, we're going to bring it forward to school committee, but we're planning a virtual school. Because of the pandemic, we sense some families might not want to send their youngsters back to live school and might consider homeschooling. We think this will be a very good option for them. We'll have a virtual school, K to 12 in Springfield. A commissioner made an announcement at his weekly meeting last week that all schools are going to have a full live reopening in the fall. So that was good news for all of us because the kids need to be back in school. And working with the health commissioner, we're going to work to provide vaccinations in our high schools, and that'll be probably starting next week. So very excited about that. That's a very important program for kids 12 and up. Again, the parents will have to sign permission slips, but I think this is a way we can help with the vaccination program. And we've had a really good collaboration between the health department and our nurses, so I think we can execute that well. That's all I have. Thank you, Mayor.
Thank you, Superintendent Warwick. We'll now get the update from the Department of Public Works from Director Chris Signola.
Mayor, thank you very much. The DPW has no employees out with COVID, and just as a notice of the DPW employees, we've had over 90% of our employees have been vaccinated. The landfill is open so for those people who want to get their yard waste over to the landfill, that is available for drop-off. On Tuesday evening at 7 o'clock, there is a virtual public hearing for the reconstruction of the St. James Avenue Tapley Street intersection. And on Wednesday at 6:30, there is a public hearing for the Highland Trail, the preliminary design for the Highland Trail project. The information for both of these virtual hearings is on the DPW website. As we've mentioned before, 311 for any issues related to traffic, potholes, etc. Bay and Berkshire and Central Street are moving along very quickly. Both will be completed this year, Berkshire Cottage in Harvey has started construction. There's obviously utility work going on, and a lot of trees have come down. On our website, we list also, and on our Facebook page, list street sweeping schedule as well as, excuse me, our construction schedule. And as the mayor mentioned, we did lose 2 DPW employees in the past week. And what I really need to do at this last meeting is thank them and all of the employees at DPW. Throughout this pandemic, along with police and fire and a few other departments, we've been working 100%. Never took time off, never downsized for COVID. And the employees provided the services they needed to the city. And we have lost 2 of them. Obviously extremely disappointed, and there will be services for both of them. So if you do happen to see any of my employees, I hope you have an opportunity to thank them. They have been working, and I very, very much appreciate their loyalty and the work for the city. Mayor, thank you.
Thank you, Director Signoli. Well put. Absolutely right. We made sure services continued to go. There was no hesitation at all to any and all of our city departments, especially the front-facing departments. I can't say enough about them. I'll speak about that later. We'll now get the update from Facilities and Parks with the Director, Patrick Sullivan.
Thank you, Mayor. We have 0 out with COVID. As the Mayor indicated, all the basketball hoops have been reinstalled throughout the city, and we're very happy to see our youth back out on those courts. I want to thank Commissioner Helen Calton Harris for all her guidance during the past few months and over the past year. And we are continuing to work on vaccination sites and park permits. Our summer jobs are posted, and we are encouraging people to sign up for lifeguard and recreation leader positions. And next Tuesday, thanks to our IT department, parents can go online to sign their children up for summer enrichment programs. They are for the Central, Forest Park, Camp Wilder, Pottinger, Renaissance, and Camp Star locations throughout the city. So we're excited to be offering summer recreation programs. And then I just also too want to thank the employees of the facilities and park department for their hard work over the past 16 months and getting us all to this important day. And Mayor, thank you to you and my fellow cabinet heads for all your support during the past 16 months. Thank you.
Thank you, Director Sullivan. And again, I always say Springfield is the business of doing business, and Chief Development Officer Tim Sheehan and his team have done a tremendous job not only to help businesses survive, but now move into the passive stabilization mode, into the thrive mode. Also, Lieutenant Governor Polito had reached out to me last week, as with Dr. Kerouac, who served on that medical board. She's asked me to serve on a board with the working in concert with the federal monies coming in on economic development, job creation, infrastructure. So I'm honored to be on representing Springfield this side on that state panel and working in concert to maximize and leverage that money for the good of Springfield and the good of the Commonwealth of Massachusetts. Without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. The Springfield labor force is made up of roughly 64,000 people. As of March, 11.2% or 7,143 people are classified as unemployed. However, the city's average unemployment rate over the term of the pandemic, April 2020 through March 2021, averaged 15.4% or 9,863 people. Within these numbers are people who are no longer statistically counted as part of the local labor force because of their prolonged absence from the workforce. Bringing back more than 7,000 plus jobs lost in our local economy will be challenging, but it must be a joint priority for both the city and the regional business community. Growing the regional employment base is key to creating greater economic opportunity for our residents and reestablishing long-term business confidence as we emerge from the pandemic.
This effort, along with job training such as the commercial driver's license training program announced last week and Springfield Works, will be a significant part of the city's reinvestment in the funding coming from the federal government. Additional programs, policies, and alliance with regional anchor institutions will be announced going forward, which focus on how to better engage with more fully employ the goods and services and labor provided by our existing local and regional businesses. Nearly every important aspect of city government involves city government employees with goods and services acquired from the private sector. Springfield will be looking at its procurement and contracting management policies as a key function that can strategically strengthen our local business and contractors, especially those that are minority, women, and veteran-owned. As an update from last week, as the mayor indicated, Wayfinders has put in place a program structure for landlords with rental residential properties of 20 units or less. This will address the vast majority of rental properties in Springfield. We continue to work through the issues around larger residential properties. As I said last week, the cases that are eligible for rental assistance should not be subject to the commencement of the eviction process, and certainly should not be coming into housing court. There is also a pending announcement on we're putting the York Street Jail facility back out for RFP, and we're looking at exploring alternative uses for that site that encourage recreational and sports. Thank you, Mayor.
Thank you, Director Sheehan. You got the update came on finances and labor and law and HR. At this point in time, we'll take any questions or comments the media might have, my cabinet heads or myself. Yes.
Are you still needing additional guidance from the Treasury Department before you put out what to spend the rescue plan money, or are you just still in the process of thinking about how best to?
No, we've again looking for clarification, a little more clarification from Treasury, but we've already established the ways we're going to go on the categories I said. So once we get those T's crossed and I's dotted, we'll be making an announcement in the very near future pertaining to those funds in those categories. But we're going to be ready to go, and I look forward to on this committee with Lieutenant Governor Polito, because I'll look to maximize and leverage what the state gets in also for the benefit of the residents and the business community of the city of Springfield.
So you already have an idea about what you're going to recommend to how that's going to be used?
Yes. 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 Thank you. Yes.
About the city buildings.
Yes.
This building, well, how long will it be before things are opened up back as normal, where you can just come in, have the main appointments, come into the building?
Those announcements will be coming very shortly, so stay tuned. Again, they're being fine-tuned with Director of Facilities and Parks, Patrick Sullivan, and with Commissioner Helen Carlton-Harris, and subsequent cabinet heads too. So we're in the process of making those announcements very shortly. The two things I'm going to say again, though, is please to the viewing or listening or reading audience, get your shots, get vaccinated. There's no excuses. Very, very simple. It's good for you. It's good for your family. It's good for our community. And the masks, again, the quicker we do that and starve, and we'll get rid of this COVID-19. But if you still feel comfortable or secure in wearing your mask, fine. And people should not be ostracized for doing that. Respect. They might have underlying health concerns. So please remember that and respect that. But as far as the city buildings, again, we've never really closed as far as City Hall. It's been very structured to protect and preserve workforce and residents. So we never closed, unlike other city halls, town halls across the Commonwealth, some which did close. And in other avenues of city services where buildings occurred, we gave outsourced services. So that's all under review. So that'll be City Hall, other buildings of the city, libraries, and then we'll have an update pertaining to our senior centers in the very near future. Any other questions or comments? I'd just like to say again, it's been a long, nearly 15 months, and I hope myself and my cabinet heads and rank and file have done you proud. We have done this a number of times with natural and man-made disasters, and I can't thank the cabinet heads and rank and file and their families enough. Many on the earlier days that were really in constant contact for 24/7. We've tried to do this in an efficient, effective, strategic, and compassionate way to give you stable and strong leadership, and to let you know, simply put, what has occurred. What are we going to do about it? And just as important, that we're going to get through this, hope, together as one. So, until we meet again, and I hope it's in person, please stay vigilant, and I wish you and your families good health and continued success. And with that, I will bid you a fair adieu. God bless.